Welcome back. We have Eisenhower Health today, and we are speaking with Reverend Jeffrey Burt, Director of Spiritual Care. He's here to talk to us about the spiritual services the hospital provides for patients and families. Thank you for joining us.
Thanks for having me.
Of course. For people who don't know, could you remind us why you have these services and what it is?
Yeah. Well, believe it or not, the government agencies actually require hospitals to provide spiritual care to patients who want it. But beyond that, you know, when you're in the hospital, you're probably having an existential crisis.
Oh, yeah.
People are often, of course, quite anxious about a diagnosis they've just received, or they may be feeling isolated from their family and loved ones. So chaplains are there to provide some support, some emotional support, and if desired, spiritual support. And you know, studies actually show that providing spiritual support actually helps health outcomes. So, so we're happy to do that at Eisenhower, and we really believe in kind of caring for the whole person, not just the physical body, but the spirit too.
Exactly. I like that you said that. The last time we spoke with you, it's not just about the disease, it's about treating the whole person. And sometimes, who knows, that helps you get better, because what's going on in here can affect your body.
Exactly right.
Yeah. Talk to me about the need, of course, for this holiday season. It's pretty high. Yeah,
you know, whether you're in the hospital or not, a lot of people are struggling with grief around the holidays. Certainly if you've lost a loved one, or if you're dealing with a health issue, and then it's the holidays, particularly if you're kind of on your own. Those are the people who most need our help as chaplains, but also just all of us can provide support to people like that. And really, we found the magic of chaplaincy is somebody to come and provide just a listening, caring presence. And you know, anybody can do that. We can all reach out to people who are struggling, who are lonely during the holidays, who are grieving, and just to provide a listening ear. We know that if people can just talk out their grief, it really makes a difference.
Absolutely. And you could certainly use volunteers. Will you talk to us about that?
Yes. First of all, I want to thank you, because last time we were on, we had some people come to us.
Oh, good.
And so that's great. And we're still really needing some bilingual volunteers.
Yes.
Spanish-speaking, English-speaking volunteers, because on any given day, about a third of our patients are Latino.
Yeah.
Of course, many can speak English, but they would prefer, of course, to receive spiritual care from a fluent Spanish speaker. And so any people who are interested in joining us as a volunteer chaplain, we provide the training. All you really need to do is be a caring person who's capable of listening and providing that support.
All religions, all languages, just reach out. All right.
Yes,
good
definitely.
to know. All right. EisenhowerHealth.org if you want more information. Thank you so much, Reverend, for coming on.
Thank you so much.
About this.